I wanted to take just a brief moment to welcome you to our call, which is the third in our webinar series on hot topics in Harrisburg. We've had two other calls, one on the topic of tax policy and the second on everything you wanted to know about pensions. The goal for this series is to provide our colleagues both in Harrisburg and throughout the state with in-depth discussion of some of the most important and complex issues that are being discussed in Harrisburg within the state capitol. We want to keep you apprised of what's happening, to help you to understand the debate, to give you the latest information, and to give you opportunities to engage in these policy debates, both in Harrisburg and also in your own communities. So today we're going to talk about the Medicaid expansion. I know there has been a great deal of discussion about this, but we are now getting close to the end of the legislative session. The General Assembly is in this week. They're gone for 2 weeks, and then June is really crunch time, and much of what gets accomplished in Harrisburg is done within that final month as the General Assembly gets down to work and tries to deal with the budget and all the policy issues surrounding that. So what we wanted to do today was to give you an update on the status of the debate. We'll talk a little bit about what's happening nationally. We'll give you some information on some of the new information that's come out about the economic benefits of the Medicaid expansion and talk about the status of the deliberation, what some of the problems are, and then talk a bit about what actions are being taken by organizations that are working to make the Medicaid expansion a reality. We have some really great speakers today. First, Jesse Kraus, who is a policy associate with the Center on Budget and Policy Priorities. He's part of their health team that includes 10 people that are focusing on implementation of the Affordable Care Act. And Jesse is looking specifically at Medicaid expansion across the state, across all of the states, and he has a lot to share with us. I will do a very brief discussion about what the studies have been around the economic impact of Medicaid expansion, and then we are very fortunate to have Antoinette Kraus, who's the director of the Pennsylvania Health Access Network, which is one of the state's leading consumer health groups representing more than 1.5 million Pennsylvanians, to talk about the Cover the Commonwealth campaign and all that has been happening with that. So very quickly, we're going to begin. We will put you on mute during the presentations, and when we are done, which should be in about 30 minutes, you will have a chance to ask questions. So I wanted to just let you know that the webinar is being recorded, and you can find it on our website if you'd like to listen again and share it with your friends. So let me introduce our first speaker, Jesse Kraus from the Center on Budget and Policy Priorities.
Great, thank you, Sharon, and hello, everybody, and thank you for allowing me to join you today. So what I'm going to do today, I'm going to do a quick kind of Health Reform 101 to move quickly through how the different coverage components in the Affordable Care Act are supposed to work together as they were originally designed, and then the reality post the Supreme Court decision. I'm going to focus on the lay of the land around the country as we get close to 2014. And then talk about some of the big policy issues still at play around the country. So what you see in front of you right now are the Medicaid and CHIP coverage levels in Pennsylvania pre-Affordable Care Act. And what the Affordable Care Act does, and first thing it does is raise the Medicaid eligibility level up to 133% of the poverty line. So this covers most of the adults around the country earning below 133%. Next thing it does is set up an insurance exchange in each state where people can go and buy private coverage on their own. For those earning up to 400% of the poverty line, there's going to be premium credits available to offset most of the cost of the coverage that they can buy there. People earning above 400% can still go into the exchange buy coverage, they just won't get that tax credit to do so. Now, so this worked very well, and last June the Supreme Court upheld the Affordable Care Act, but it essentially made the Medicaid expansion a state option. The Supreme Court said that funding for a state's current Medicaid program could not be tied to whether or not they expanded their Medicaid program. So like I said, in effect, it made it a state option. And what it does is it removes that Medicaid eligibility for those folks earning below 133% of the poverty line. Now, as a little quirk in the health reform law, it says that if there's not Medicaid coverage available for those between 100 and 133, they can still get premium credits to buy coverage in the exchange. But what happens is for all these states that don't expand, there's going to be this huge coverage gap there for people making less than 100% of the poverty line. They're not going to qualify for Medicaid, and they're not going to qualify for premium credits. So for this expansion population, it's important to note that there's a very generous matching rate that comes along with it. The federal government for the expansion population will pay 100% of the costs for the first 3 years, and that'll go down over time to 90% in 2020 and every year thereafter. The administration has been very clear that states can come in whenever they want, so they can come in January 1st, 2014, June 1st, 2014, January 1st, 2017. But that 100% matching rate is only available for calendar years 2014, 15, and 16. So I know Pennsylvania's legislative session goes on and on forever, it seems like. But around the country, we are getting a better idea of where states stand, as many legislative sessions have wrapped up or are wrapping up. And right now, we think that there's 21 states that are definitely going to expand, which it's actually 20 plus the District of Columbia. There are 4 more that are leaning very heavily toward expansion. They're not all the way there yet. This map in front of you, you can see the states. Of note, to date, there's been 8 Republican governors who have come out in support of the expansion. 6 of them are in states that either definitely will or most likely will expand. Governor Kasich in Ohio and Governor Scott in Florida are the 2 that have found the most pushback to their expansion plans in their states. So you look at this map and you see that about half the states are in and half are not there yet. But one caveat is that those 25 positive states only contain about a third of those who are projected to get coverage through the Medicaid expansion. And that's simply because states like California and New York have very robust Medicaid programs as it is, whereas there's a lot of uninsured in Texas and Florida. So the undecided states, of which Pennsylvania is still one, are ones that it is still possible for January 1st, 2014. And that's the important distinction. So now I'm going to get into the weeds of some policy around the expansion, and Sharon asked me to talk a little bit about what has become known as the Arkansas model. And to talk about what's happening in Arkansas, you have to talk first a little bit about this concept of premium assistance in Medicaid. And what premium assistance basically is using Medicaid or CHIP funds to purchase private coverage for an individual. And it's important to note the premium assistance has been around for a while in Medicaid. To date, it's been used mostly to pay the employee cost of employer-sponsored insurance for very low-income people. It's been a way to keep low-income people on employer coverage rather than them going without coverage and maybe ending up on a state's Medicaid program. But as far as premium assistance in the Medicaid expansion, it actually first popped up in Ohio, where as part of Governor Kasich's proposal to expand, he wanted to focus on the population between 100 and 133% of the poverty line and give those people the option of taking the Medicaid dollars and getting coverage through the exchange. Arkansas came into the picture because they have a very supportive governor, but a very oppositional legislature, and Governor Beebe had to get 3/4 of his legislature to sign on to their expansion plan to make it a reality. And so his expansion plan would move the entire expansion population into the exchange. And this really upended the whole conversation around the country, around the expansion when it first came out. There were not a lot of details, and over time we have found more details out about what this Arkansas idea will look like. There are still some important questions that have not been answered, but we're hopefully going to find those out over the months ahead. Now, this is a very different idea and it's a very different way to conceptualize Medicaid coverage. There are benefits potentially to using these Medicaid dollars to purchase coverage in the exchange. The state of Arkansas says there are more robust provider networks in exchange coverage. You can reduce the churning between Medicaid and exchange if more people are in the exchange at different income levels. And then also they're making the argument that it'll make the exchange more healthy by having a larger risk pool of folks in there. A big thing that Arkansas has to get around to make this work is this idea of cost effectiveness. Because basically, if you're going to use Medicaid dollars to give people private coverage, it has to cost the same. And of course, we all know that Medicaid is cheaper than private coverage. This potentially could work in Arkansas because Arkansas has made the argument that there is not as much of a difference between their private coverage and Medicaid coverage as there is in other states. They think there's about a 15% differential, whereas around the country it's more like 50%. And then they also say that they're going to be able to find savings elsewhere by, again, reducing churning. And at the end of the day, it is their belief that the cost will be the same. We will wait to actually find out if that is true. So this Arkansas idea, got a lot of attention. A lot of people got really excited around the country. Well into the double digits number of states that have talked about it, among advocates, among policymakers, governors, legislators, all over the place. And on the screen you can see Michigan, Missouri, New Hampshire, Oklahoma, Florida, and many others. The important thing is that while this has been much discussed, Arkansas is the only one that is actually moving ahead on this. And in many states, it has only been discussed, and in many states, the people talking about it don't really know the particulars of how it would work. And there are important protections for beneficiaries that come along with it. Some of these folks probably aren't aware of. That said, there are two states where an Arkansas-like model has gotten pretty far. The state of Montana will not expand for 2014, but they came very close to expanding their Medicaid program, and the bill that they had in front of them in the legislature was the exact copy of the bill that Arkansas passed. And currently, Louisiana, of all states, has passed an expansion bill out of committees in both the Senate and the House that expands Medicaid with, again, the same exact legislation that Arkansas passed. We do not think this will ultimately get anywhere in Louisiana because Governor Jindal remains very opposed. But in Louisiana, at least, this discussion of premium assistance actually kind of reignited the expansion debate that was, for all intents and purposes, dead. So with all this talk about premium assistance and Arkansas and alternative paths toward the expansion, it's important to talk about some of the guideposts that CMS has put around the expansion over the last few months to try to give states direction on how they can or cannot expand. To the Arkansas model specifically, in March, CMS released a very useful piece of guidance that put in some very strict guideposts around any state that wants to expand using premium assistance. So this guidance made very clear that if you do premium assistance, the population are still Medicaid beneficiaries, and the beneficiaries are entitled to all the benefits accorded to the expansion population, all the cost-sharing protections that come along with being a Medicaid beneficiary. CMS said that an 1115 waiver is necessary for any mandatory expansion using premium assistance. And that's going to be very important. I said earlier that Governor Kasich wanted to do a targeted expansion to make it optional, but a waiver is going to be necessary if it's going to be broad and if it's going to be mandatory. And then, so CMS in this guidance said that they were going to approve a limited number of demonstrations around premium assistance. So they're not looking to do this in 20 states. And again, there's only one state that is actually moving forward with this, well, that is far down the field, and that's Arkansas. So this 1115 application and comment period and the whole process is starting now in Arkansas, and some of the questions that we and other advocates have hopefully will be answered over the next few months, questions around cost effectiveness, and making sure that those beneficiary protections are included. And then finally, this guidance goes back and really encourages states, if they're going to do this premium assistance idea, do it the Ohio way, target it at the 100 to 133 population. The next piece of, the next guidepost that CMS put up was actually just within the last few weeks. It involves enrollment caps. And CMS just made it very clear that you can't cap enrollment in the expansion group. Previous 1115 waivers that expanded coverage, you could put enrollment caps in, but CMS said for the purposes of the expansion population, if you're pursuing an 1115 waiver, no enrollment caps. It's simply because demonstrations have to further the objectives of the Medicaid program, and putting caps on a population that today does not have caps does not further the objectives. The next piece that I think is important to note is around partial expansions. This was very much discussed last fall, where states really wanted to only expand up to 100% of the poverty line. You'll recall that if Medicaid is not available for people between 100 and 133, they can get premium credits. So a lot of states said, well, let's do it just a partial expansion. CMS in December said no. You can, if you're going to, there are no partial expansions, and you definitely can't do it to get an enhanced match. So a few weeks ago, CMS reiterated this. They said if you want that enhanced match, the very generous 100%, you have to expand to 138. This is relevant because you may hear, or we think that Wisconsin is going to expand to 100, and I'm doing air quotes around the term expand when I say that. And that's simply because Wisconsin has very generous Medicaid eligibility right now. And Governor Walker's idea is to lower that eligibility down to 100 and then move everybody else into the exchange. But he's not going to get the enhanced match for dropping to 100. He's going to get the state's normal match to go to 100. And it's from a state's perspective, it's not a good idea. All the analysis in Wisconsin say that this is a net loss as compared to what their budget would look like with a normal expansion. But Governor Walker is very dead set on this. And so you may hear about this, that Wisconsin is doing a partial expansion. It's not really a partial expansion because they're not getting that enhanced match. And then the final one, I believe I've probably spoke with a number of you at the conference in Harrisburg in February, and I spoke about this letter from CMS to Virginia's Secretary of Health and Human Resources. And this letter did not contain new information, or it was not a breakthrough, but what it indicated was that CMS is willing to work with states to give them the cover that they need to get to yes. This is an important way of looking at the expansion. What do we need to get for people who may be on the fence to get them to yes on the expansion? And so this letter that was sent to the Virginia Secretary from CMS, it just reiterated some policy issues that was in a proposed rule they put out in January. But what it did was it allowed some Virginia legislators to say, Virginia legislators who, for example, wanted Medicaid beneficiaries to have, quote, more skin in the game with their health coverage, it allowed them to say, we got this from CMS, now I can go forward and vote for the expansion. So as perhaps some of you are working with legislators who may be on the fence, just remember that CMS is willing to talk with folks, and they're open to discussions. But they, like I've said along the way, they've drawn some very good lines in the sand about what you can and cannot do around the expansion. So looking ahead to the rest of 2013, Pennsylvania is one of the last states that is just still in its legislative session, where sort of the normal legislative processes are playing themselves out. A lot of states have wrapped things up. In a number of these states that are not going to expand, advocates there and legislators there are starting to think about their 2014 strategy. Couple of, I don't know if they would want me to call it this, but Hail Mary tactics going on in states. For example, a couple of states are pressuring their supportive governors, advocates are, to call a special session to address Medicaid expansion. So that could happen in Montana and in Florida, where the legislature has rejected it, but the governors may call them back to address the expansion. A couple states have punted on the expansion and instead said they're going to set up commissions to examine the Medicaid program generally and give recommendations for reforming it, and also to report on whether the state should expand. For these states, even if there was a positive report that came back, it probably would not allow the state to expand on January 1st, 2014. And then over the last few weeks, there's been talk in states that did not expand about doing a ballot initiative in 2014. And so this is general election 2014, so November, 11 months after health reform comes online. But advocates in Ohio and in Montana and South Dakota are talking very seriously about going around their legislature and putting it on the ballot. This is a very high-risk, high-reward strategy, and something that you would only want to pursue with a lot of deliberate thinking around it. But it's something that's popped up recently, and so we at the center are very curious to see if it pops up in other states. And then I threw Arkansas in there because there have been some anti-expansion rumors out of Arkansas that they will put it on the ballot to repeal the expansion in November 2014. So that's kind of the lay of the land with where we are in the expansion right now. This is my plug up here for some of the work that the center has done around the expansion. There's a link there when you get the slides to go to our Medicaid expansion toolkits. A lot of good information there. And of course, shoot me an email or any of us at the center if you have any questions about the Medicaid expansion. And so I will turn it back over to you, Sharon.
That's great. Thanks so much, Jesse. That was extremely helpful, giving us a good understanding of the lay of the land in other states and what some of the policy issues are. I want to spend just a couple of minutes now talking about what's happening in Pennsylvania and try to address the question, which is on everyone's minds, will we have a Medicaid expansion this year in Pennsylvania? And what I think that the broad conclusion is that we have some good news and some bad news, but there's still an opportunity for us to get this done this year. Okay. The next slide, I'm not being able to get it myself. There we go. The first point that I think is very important for us to realize is that there is clear bipartisan support for a Medicaid expansion in Pennsylvania, but it is also clear that lawmakers, particularly leadership in the House and Senate, are really waiting for the governor to take the lead and make the decision on this important topic. The first public indication of support we had from a Republican was Senator Lloyd Smucker, who talked at a town meeting in his district back in March, made some very favorable statements about the value of the Medicaid expansion. And I think that his statements really are echoed by a number of other members in the Senate and to a lesser degree in the House, but particularly in the Senate, who see the benefit in terms of cost, in terms of coverage, and increasingly there's a recognition that cost savings associated with the Medicaid expansion could help in the short term. So the key question here is, I think the way to characterize this at the moment is that there's support in the Senate, there's overall quiet in the House, although the surprising quiet in the House. Prior to this year, there was a lot of noise in the House from members who were against the Medicaid expansion. We've seen a tremendous diminishment of that sentiment, and so I think there's some opportunities for us there. Next slide. So one of the things that's occurred over the past few months is, in fact, a series of studies have been released that have shown the positive impact of potential Medicaid expansion here in Pennsylvania. And the three studies were authored. The first to come out was by the RAND Health Group for the Hospital and Health System Association in Pennsylvania. Second was by the Pennsylvania Economy League for the Health Funders Collaborative in Pennsylvania, and a third report from the Independent Fiscal Office, which is based in Harrisburg. And each of the studies showed very positive impacts for a Medicaid expansion in Pennsylvania, and remarkably similar numbers in terms of the benefits. And those benefits are pretty clear. First, in new jobs, somewhere between $35,000 to $36,000 in potential new jobs in the Commonwealth in 2016. That number is, those numbers are close to a report that was released earlier by Families USA that pegged the number at 42,000. But clearly, the expansion will bring federal dollars into the state, and that will help to create jobs in the healthcare system and elsewhere. The second is the newly covered uninsured. The studies use various different numbers, some based on the Kaiser Family Foundation's report. The Independent Fiscal Office does its own very detailed analysis of who would be affected by the Medicaid expansion. But they come out again with remarkably similar numbers, somewhere around 320 to 350,000 newly covered uninsured, and an economic impact in terms of gross state product that was in the billions of dollars. They all are very much in agreement as well on the total amount of new federal dollars that would be coming to the state beginning in 2014. Next slide, please. And each of these reports identifies a number of cost savings. And I wanted to address this both because the cost savings are pretty significant, and they generally come from a couple of areas. The biggest area of cost savings is in healthcare for individuals who were formerly receiving general assistance, that is, their health is currently paid for 100% by the state. And although the enrollment in that program has gone down significantly as general assistance cash grant program ended, that's still a sizable cost savings for the state. There were some other cost savings in other health programs, like Plan for Women, and some cost savings for inpatient services for inmates in state correctional facilities. And I want to address the issue of behavioral health. This Commonwealth pays now more than $600 million, about $689 million in funding for mental health services and behavioral health programs that are administered by the counties. And that's a considerable amount of money. Two of the studies have identified cost savings in that area, but I know some people are concerned about that. The cost savings that were identified both in the Economy League study and also in the Independent Fiscal Office study are very, very small, about $50 million out of $689 million. And that is really, they just considered the number of people who would be Medicaid eligible, newly eligible, that currently are not. So at least in these cost analyses, the bulk of behavioral health funding would continue to go to the community-based programs that are currently offering them. And the programs themselves found, or the studies themselves found, savings of between $300 and $400 million in 2016, depending on the study. Next slide. So let me go through it very, very quickly. Important area to note that all of the studies agreed on is that many of the costs that are associated with the Affordable Care Act will be incurred anyway, and that the Medicaid expansion will draw in additional new dollars and provide new coverage, but and will result in a net savings that if Pennsylvania does not do the Medicaid expansion, it will incur a number of costs. And those are related to a couple of areas. One is the cost of moving some of the children who are currently enrolled in the CHIP program over to Medicaid, which is required under the Affordable Care Act. And then the second is the currently eligible individuals, the people who have been unfortunately named woodwork. Those individuals are currently eligible individuals who, with the combination of the opportunities through the exchanges and also, or the new publicity around the exchanges, and also the personal responsibility requirement, are likely to enroll anyway. Next slide. Any luck with the slide? So this is just a slide, and I took the enrollment numbers from the Independent Fiscal Office study just to give you an indication about in terms of new enrollment, it will be roughly 782,000 additional people by 2019. About 100,000 of those are people who would have enrolled anyway, or adults who would have enrolled anyway, or will enroll even if Pennsylvania does not expand the Medicaid program. And then certainly a number of children would be moved over as well. Next slide. And you can take a look at this. Oops, something got messed up on my slide. But what this slide shows you is the Independent Fiscal Office analysis of the cost savings for Pennsylvania. And that is a combination of reduced healthcare spending and tax revenue. And this is done on a fiscal year basis. So you'll see for fiscal year 2014, that means beginning January 1st through June 30th of 2014, Pennsylvania could see a savings of $154 million and new tax revenue of $11 million for a total of $165 million. And then the numbers go up through 2016, and then they start to go down as Pennsylvania, as the matching rate goes down. What's a little bit difficult to see here is that one of the areas of concern is an issue related to Pennsylvania's gross receipts tax. Several analyses, including the Independent Fiscal Office, assumed that newly enrolled individuals under who will be in Medicaid managed care plans would also be drawing down additional match from the feds. That assumption is one that is in question right now, but what the analysis shows is that even if you take the new revenue from the gross receipts tax off the table, that Pennsylvania still sees cost savings all the way throughout 2021. And that number of 108 million is somewhat comparable to the HAP number. So there are a couple of challenges to the expansion. Let me go through them very quickly so we can move on. There has been a lot of discussion about costs, and the administration, the corporate administration has made the cost a real issue. And what is important is to separate what are costs that are going to be incurred anyway versus cost of the expansion. And there are a number of things that will be incurred anyway. So again, making clear that by expanding Medicaid, Pennsylvania is able to draw in additional revenue that can both defray the costs and also grow the economy. We talked a little bit about the CHIP kids. The gross receipts tax issue is one that has been of great concern. But again, the analysis clearly showed that even without the additional revenue from the gross receipts tax, it makes financial sense to do this. Concern over the continuation of the federal match. There are some lawmakers, and the governor has expressed a concern about whether the 100% match in the first years and the 90% match moving forward is something that the state can depend upon. So that is an issue. It's one that has been raised in a number of states, and some states' legislation has included a trigger which would allow the state to opt back out should the federal match rate fall below what's currently in statute. There's an issue about flexibility. We know that the corporate administration has met with Secretary Sebelius on April 2nd. We know that they were looking for flexibility. There are a number of areas and a number of questions have been asked about what that is and whether or not it will be granted. And we're still not entirely clear how the administration want to shape the program. And then the final challenge we have is that we may be running out of time. Again, we're getting near the end of the legislative session, as you heard Jesse say. Some states have been moving forward without addressing the expansion and ended their legislative session before doing so. The benefit we have is that our General Assembly will be back in the fall if this issue needs to be addressed further. So next slide, please, Chris. So the question that we all want to know is, can the Medicaid expansion happen this year? And the answer is yes. It can be done legislatively. There is some discussion about that occurring. Thanks to a great memo that was done by Community Legal Services, sort of laying out what the options are. I believe there's an understanding that the Commonwealth needs to appropriate the federal money, but can leave the program design issues to be dealt with later on. There has been some conversation about including some language about a trigger or an opt-out, and if that's done, it could assuage concerns about the federal match or the financial solidity of the program moving forward. And again, the details can very well be worked out after the budget. There's been a lot of back and forth. Last week, Senator Pileggi made a statement and said we need to hear from the governor in the next 2 weeks if we're going to make this happen. On Friday, DPW Secretary Bev McArith said that she did not think Pennsylvania will be ready until 2015. So there is some tussling back and forth on this question of when and how. But clearly there's a lot of work to be done between now and the end of June to move this forward. So let me turn it over to Antoinette Kraus to talk a little bit about the Cover the Commonwealth campaign and the efforts that will be undertaken in the next 6 weeks to make to bring a conclusion to this issue.
Thanks, Sharon, and thank you for organizing this call. So I just want to talk real quick in general about the Cover the Commonwealth campaign. We are a campaign that has been in existence since January, and the main focus is obviously to make sure that Pennsylvania moves forward with the Medicaid expansion. Currently, we have about 120 organizations signed on to the campaign and 5 work groups that really drive the work of the campaign. That includes education outreach, communications, legislative advocacy, policy, faith, outreach, and enrollment. Next slide, Chris. So, you know, we have been working really hard to get the economic argument out in front, you know, to make the argument that we can't leave this money on the table. It will help create jobs, it'll offer coverage and save taxpayers millions of dollars that otherwise is spent to treat the uninsured in emergency rooms. So over the next 6 weeks, we want to really focus on who's going to benefit from the Medicaid expansion. Hardworking, low-income families really need the security of knowing they can get health care when they need it without facing huge medical bills. So we are launching an aggressive campaign over the next 6 weeks to really put pressure both on the legislature and the governor. We are going to focus on highlighting individuals that would benefit from Medicaid expansion all across the state. These are really working individuals. So we are going to have a big day of action and a rally on the front steps of the Capitol on June 12th at 1 o'clock. And we'll have buses leaving from Philadelphia, Pittsburgh, and Erie. So we're asking folks to help spread the word to your networks about this event on June 12th. If you work with folks that would benefit from the Medicaid expansion, we're looking for organizations to help identify those folks that we'll share with the media and legislators. And we're asking folks to participate in local events or call-in day. Next slide. So we are doing a series of events and actions leading up to the June 12th event. So starting the week of May 27th, we're going to have constituency call-in days. And we're targeting key constituencies that would benefit from the Medicaid expansion and asking them to call key members of the General Assembly and let them know that this would benefit their group. So Monday, which is Memorial Day, we're going to focus on veterans. Tuesday, nurses, physicians, hospital workers. Wednesday, women. Thursday, disability groups. And Friday, uninsured and unemployed workers. So if you want to participate in any of those call-in days, we will have links and tools for organizations as well as links to share on social media. The following week of June 3rd, we're going to highlight an individual who would benefit from Medicaid expansion every day, both in the media and with legislators, and asking people to join these individuals in Harrisburg the following week. On May 23rd, we're going to do a big social media event, an action day, a Twitter rally targeted at key members of the appropriations, as well as an email day for legislators. Part of the big Harrisburg event is to, bring folks that'll benefit from the expansion to Harrisburg and also highlight the stories that'll benefit. So we are holding events across the state where we're asking people to come and bring photos of folks that would benefit from this or come and share their story and to promote the June 12th event to both put pressure in key legislative districts and really drive turnout to June 12th. So if you're an organization or someone that wants to organize one of these events, let us know. And the Democratic Policy Committee will be holding a hearing in Scranton on May 23rd, which we're also encouraging folks to attend. So the next slide just has my contact information if you're interested in plugging into the campaign if you're not already a part of it, joining a work group, or participating in any of these days of action, or you have stories of individuals that you want to share. So thank you.
Thanks very much, Antoinette. That's quite a lot of activity and sounds absolutely great. So let us now open up the floor for questions. You can raise your hand. And Chris can call on you, or you can type in a question. So Chris, let me turn it over to you.
Sure, thank you, Sharon. We have, as Sharon mentioned, there is an icon with a hand and an up arrow. You can click on that to raise your hand if you would like to ask a question. We'll unmute you and give you an opportunity to do that. A few of you have raised your hand, and we will get to you in a moment. But I am going to start off with just a few questions that have been submitted in writing throughout. And there were a few just asking for some clarifications around, I think primarily for Jesse, around what he means when he talks about benefits that are wrapped around. And you also mentioned an 1115 waiver, and some folks were asking what exactly that is.
Okay, so what an 1115 waiver is, it's a waiver that has been used sort of in the pre-health reform world to try out different ways of getting people Medicaid coverage. And it's getting coverage to people who are not currently Medicaid beneficiaries. And so a state, like a famous one is in Indiana. It's called the Healthy Indiana Plan. And they set up what are basically like health savings accounts for low-income adults. It's a capped enrollment program, and it's kind of outside of the normal Medicaid program in the sense that they don't get the typical Medicaid benefits. They have to pay a little bit more out of pocket than normal Medicaid beneficiaries. But the big thing is that these are not normal Medicaid populations, so you can dispense with some of the Medicaid rules. But in the ACA world, 1115 waivers are still going to be with us, but you can't like dial back the protections and the benefits and the cost sharing protections. You can't give somebody less than they would otherwise get. And then as far as the wraparound benefits, that mostly has to do with high needs populations. The benefit package that you would get in the exchanges would not have all the benefits that would be accorded to you if you were a Medicaid beneficiary. And so what CMS has said is that if people go in and get coverage in the exchange, that benefit package that they get there, if there are benefits missing that would have been accorded to them through a typical Medicaid package, the state has to ensure that those beneficiaries still get access to those benefits.
Okay, great, thanks. We had a question from Beth Lewis. Beth, if you're on the line, I'd like to unmute you and give you a chance to ask this question yourself. You were looking for a little bit more explanation related to the costs behind the ACA and the Medicaid expansion. Are you there, Beth?
Yes. Can you hear me?
We can hear you. Go ahead and ask your question.
Okay. Oh, no, that was just a question for the second, I guess it was Sharon. She had a slide on the costs, and she went, it went quickly, and I didn't get basically what she was talking about when she mentioned ACA costs versus expansion costs, and then she mentioned the whole issue of gross receipts tax, which I also didn't get. So I was just asking for clarification around that.
This slide shows what the positive fiscal impact would be by fiscal year. And so it includes, the top line is the reduced expenditures for healthcare services. The second line is new tax revenue that would come in through the economic activity. And so that positive number, 165,492 million in 2015 and onward, is the net positive effect in Pennsylvania. So it's a good question, and I'm sorry it wasn't clear. Because of really two things. It's expected that a number of individuals will apply for Medicaid regardless of whether the state opts to expand. So, for example, there will be, beginning October 1st, a great deal of information about enrolling in healthcare coverage and the value of that, the fact that programs are available. An individual may go to the exchange or will go to the exchange in order to get healthcare coverage and be determined to be Medicaid eligible. So the state would incur that cost of that individual anyway. In addition, because there are personal responsibility requirements under the ACA, individuals will go out and seek to get health care coverage, and so they'll enroll, and some of them are Medicaid eligible currently. So again, there are some costs that would be incurred. There are other costs that would be incurred, administrative costs, information technology costs, all of which have to be are expenditures that will happen anyway because of other provisions of the Affordable Care Act. So each of the studies looks at those costs and the enrollment associated with them, and then says, all right, what's the net impact of the Medicaid expansion in terms of costs and benefits? And all of those studies then find that there are substantial cost savings and also considerable economic benefits from expanding Medicaid.
Joanne Tostavasi is on the line. Joanne, you had a question. You are unmuted and you can go ahead.
The question I had was from Antoinette. There was two things. You said on May 23rd that you're going to be basically doing a social media event. I did not see blogging on there. Was wondering if that's going to be part of it, and if so, do you have talking points for those of us who can blog, can help out with that? And the second question is more personal because I'm going to be in South Carolina for 2 weeks after that, and I'm wondering if there's what can be done for those people who are going to be out of the state during that time.
Thanks. So yes, blogging will be part of the social media push, and we will have talking points that we'll send out, and I can send that stuff to Chris, and he can share it with folks that are interested in that. And you know, we would encourage folks that from wherever they are, you know, we're in a critical period. We need to make sure that Medicaid expansion is front and center as we move through the budget process. So we would encourage folks to email their legislators, call their legislators, and let them know this is an important issue. And if you happen to be on Facebook or have access to the internet wherever you are, we want to make sure that we're pushing the message out on social media. So if you can share memes and contact info that we'll be putting out there, that would be helpful as well.
Great. Yeah. We typically do an email to follow up. You'll get an email tomorrow from us thanking you for participating in the webinar and linking you to resources online, and we'll make sure that we link you to the resources that Antoinette mentioned. I also have a question here just asking if the slides will be made available, and yes, we will make the slides available on our website, penbpc.org/webinars. You can go there and find all the resources from this webinar, including a recording of the webinar itself if you wanted to go back and listen to any parts of it, as well as the PowerPoint presentation. Seeing no questions, I think I'll hand it back over to Sharon to wrap things up.
Sure. Thanks, Chris. I want to thank our speakers again for participating in the webinar today. Jessie Cross-Call from the Center on Budget and Policy Priorities, and Antoinette Kraus from the Pennsylvania Health Access Network. And I want to let you know that our next webinar is currently scheduled for Tuesday, May 28th, and that webinar will be on education funding.
We're losing you again, Sharon. Sorry.
Oh, sorry. That webinar will be about the status of education funding cuts. Did they or didn't they? Did the General Assembly actually make cuts to education? How deep were they and how were they distributed? And that will be on Tuesday, May 28th from 4 to 5 p.m. So thanks very much for joining us today, and we appreciate your time. And feel free to email us or give us a call if you have any questions. Thanks.